Hello everyone, I'm Sela and I'm one of the Springboarders here at GirlSpring's. I'm here with several other Springboarders who will introduce themselves as well.
Hello, my name is Suniti Chambers.
Hi, I'm Ayana Chaudhary.
And we are here today with Dr. Vipul Shah, Clinical Director at PAC Health, to ask some questions about the current pandemic, COVID-19, and what we can learn from this experience, as well as how we can obtain medical care and keep others safe during this time. So hello, Dr. Shah.
Hello.
So to start off, would you mind telling us about PAC Health and how it can be a useful resource during this pandemic?
Absolutely. First of all, thank you very much for having me on, and I think this is a great program, and I really appreciate everything that you guys are doing in terms of educating people. So PAC Health is a digital health coaching program that a company that has been based in Birmingham, and we started out in the chronic disease space, so doing a lot of diabetes education and weight management, but we're expanding to a lot of other conditions. And during the COVID-19 pandemic, we have been able to assist the city of Birmingham and as part of the BHAM Strong program, as well as help our members during this time really learn about how they can access medical care during the pandemic. As you know, a lot of medical clinics are not operating in the normal ways. So how to access telehealth, also giving them information about COVID-19. I think everyone is aware that there's a lot of misinformation about COVID-19 right now. So our website is really a good resource for finding kind of information that's reliable, that's going to be evidence-based. So we're really trying to give our members and the public a space to find good information. Beyond that, we're with other organizations as well to make sure that we're helping people get groceries if they need it, helping them find medications if they need it. So just trying to be another resource for everyone during this time.
On the PAC Health website, you have provided videos discussing updates on COVID-19 and telehealth. In one of these really insightful videos, you go into thorough detail concerning telehealth with your wife, Dr. Brandy Shah. And so first off, what is telehealth and what do you think are some key takeaways about telehealth and telemedicine?
That's a great question. So telehealth is basically another way of interacting with healthcare providers. So as you know, the way that we typically medicine has always kind of worked is where you go into the doctor's office and you talk to your doctor and you can get your prescriptions and everything that way. Telehealth is not new to COVID-19. It's been around for many years now, starting with kind of just telephone calls. But as technology has really advanced, telehealth has advanced as well. So now you can interact with your providers, whether it's through your computer via video chat versus just on the telephone versus text messaging. And one of the things that's really changed about COVID-19 and telehealth is that now, whereas there were very strict requirements about who could use telehealth before, with COVID-19 and the stay-at-home orders and the closing of a lot of physical offices, what the government has been able to do is to say that all telehealth visits are now going to be paid for by standard insurance. So if you, rather than having very specific guidelines around whether you live in rural parts of the country or if you just don't have as much access as other people, now pretty much anyone can access telehealth. So telehealth and telemedicine are just new ways to really get in touch with your providers. And that doesn't just mean like for the typical medical things. You can also access mental health visits. You can and get basic checkups, things like that. So it's a new way or a more accessible way during this time to reach out to your providers.
We see the never-ending obstacles and challenges doctors face today. What advice would you give to those who plan on being doctors in the future? And how would you encourage them to stay motivated in their journey?
So I think this is really an interesting time in medicine. I think being a doctor is, like you said, it's a long journey to get to being a doctor. And just so we're all on the same page, you have to go through undergrad, and I did my undergrad in history and cellular molecular biology, and then you obviously do that, and then you go through your medical school training, and then residency, and if you decide to do fellowship. So it can be a long journey. And there are a lot of obstacles and challenges, I think, to becoming a doctor. I think the thing about it is if you really want to be a doctor, or if you want to be in healthcare in general, I think you have to have certain motivations to start, right? So if you want to be involved with people, you want to help people, you want to understand science, you want to apply science to making people better, these are all things that can serve as motivation. So if you're focusing on sciences but it's not just science anymore, being a good doctor, being a good healthcare provider, whether that's being a nurse, being a physician's assistant, there's a lot of ways in which you can interface with patients now. And I think if you care about people and you care about the connections with people, that's a really important part of medicine that I think is becoming much more important in what we're pushing to as new physicians, as medicine changes. So the obstacles are, a lot of them are regulatory. So the government and billing and insurances, they're not necessarily obstacles, but they're ways in which medicine is changing. So I think it's important that if you're interested in medicine, that you keep your eye on the prize at the end. I think we all want to take good care of people and take good care of patients and give everyone the best care, but also want to really push the science forward too. So there's a lot of ways in which you can be a doctor that aren't just either clinical or research, or being in healthcare. So I think it's really important to kind of keep your eye on that prize, like I said. And in terms of keeping yourself encouraged and motivated in the field, this is really the heyday for being a doctor or being in healthcare. This is where this COVID-19 time has shown how much healthcare is a part of everyone's life and how important it is to understand the science and to be a part of that. And so it's really exciting on one end, but it's also very important to be a part of the healthcare field right now. So I think watching how healthcare providers are being looked to at this time really shows you how important it is as a healthcare provider right now, and that can motivate you as well right now.
A lot of teens have heard that older age groups and people with heart disease, diabetes, or asthma are mainly at risk for COVID-19. But what would you say to the teens who feel they shouldn't worry or concern themselves with the virus due to this information?
So I would say that, first of all, I think we all know that the older age groups are the ones who are at risk for the worst complications of COVID-19. So like you mentioned, heart disease, diabetes, lung disease, these are all people who can get very sick with COVID-19. I'd say to people who feel they shouldn't worry about this, I think everybody has somebody that they love that has some of these diseases, first of all. So if your parents or your grandparents or your friends or your neighbors have these conditions, they're really at high risk of suffering really severe complications. So if you have anyone that you love that has these conditions, it's really important that you also take those precautions, because even though if you're younger, you may not show a lot of the severe signs, you can pass that along to somebody that you love and they could have the really severe complications of it. To the other end of that is we don't actually know just who is going to get sick from this disease. Yes, it's true that younger people do not suffer the really severe complications at the same rate, but anybody can suffer pretty severe complications from COVID-19. And that's what we've seen is even if the percentages tell you that you're most likely going to be fine, you never know when you could be that person who gets really sick. But I would say that my bigger point is that we really need to take care of the most vulnerable in our populations. And these are people that you love. So really thinking about who this affects and who this affects in your family and in your neighborhood, it's important that you also take the same precautions.
So, Dr. Shah, when you were studying to become a doctor, did you ever expect having to face a pandemic of this scale? And were you aware of any signs that a pandemic would erupt soon?
So when I was training, I trained at the University of Pittsburgh in medical school. And we used to do kind of crazy. We used to do pandemic or disaster response drills. That doesn't mean that I think we expected anything like this to erupt, but I think as anyone who's interested in public health, as I am, as my wife is, you know that this is always a possibility. And I think some of the things that made me more acutely aware of this was the Ebola crisis back in 2016. I think as Ebola was really coming up, it was clear that our public health systems, not just in our country, but around the world, were at risk for something that could spread quickly, and that could be something like this. I think the avian flus and the H1N1 scare was a little bit earlier, when I was just getting into residency when that was starting. And then SARS was even earlier than that. So I think we've known that this was a possibility. And I think after these multiple different mini infectious disease scares, it's always been on our radar that something like this could occur. So at the hospital that I worked at before I moved to Birmingham, we actually did a lot of the work that's happening now in terms of hospital preparedness for certain infectious disease like this. But I don't know that any of us thought that this would get to the global scale that we're at right now, or you couldn't have predicted it was going to be this one, but I think we all were aware that there was a possibility of it.
So currently there are a lot of teens with parents or grandparents or anyone in their family who may be more resistant to the thought of staying at home or even COVID-19 itself. What advice would you give to those who want to educate their family on proper procedure during this time?
That's a really good question. I mean, I think we get a lot of misinformation about COVID-19, and we get a lot of misinformation about what the risks are for people. So I think that it's important to make sure that everyone understands that this is it is a very serious disease. So I think continuing to show people who are resistant to that, kind of give them the most reliable information and the information that's based in the science. I think we have to take away some of the opinion pieces and really look at what the science is telling us, and try to say that, the numbers tell us that it's, that the disease is spreading quickly. And yeah, it is certainly a new and evolving epidemic, but I think stressing that we all want to take care of each other and we want to do what's best for everyone. And so if you want to educate your family or your friends about this, it's really about saying we are all in this together to some degree. So we have to, even though it may not seem that it's going to affect you directly, we have to take care of everybody in the population, and looking at the most reliable sources like the CDC, like our public health officials, who, like you, in that question you asked right before this, our public health officials have known that this was a possibility. So a lot of the things that they're working off of, or the models that they're working off, are ones that have been tested with other diseases. And so the understanding that's coming out of science is really where we want to look. And so staying away from the opinions of other people who don't really have a lot of the background about this is really where I would recommend looking, and trying to say that a lot of people think that they're experts in this right now, but there are people who actually are experts in public health and in medicine and in government responses to this. So I think we do need to look at the experts on this and take what they're saying, rather than the opinions of people who don't really have a lot of understanding about this.
Okay, so Mobile County has surpassed Jefferson County in its number of confirmed cases and deaths, even though Jefferson County has 200,000 more people. What factors outside of population affect transmission?
So it depends on how. That's a good question. I think some of the places that we've seen are really hot spots. It depends on where the virus really started. So I think in certain places where nursing homes had very widespread, in places where that sort of occurred, if certain places were late to implement stay-at-home orders, or people aren't taking them as seriously, those are certainly places where transmission can occur at a higher rate. But I think based upon, yes, Jefferson County is certainly more populous, but I think what you're seeing is that in some of these hot spots, what happened is that they've started in places where there's a lot of residents, like I said, a nursing home, which can really make that, which can really amplify the effects of the virus, because there's not necessarily the ability to stay isolated in some of these places. And so we know that that's an issue, and it depends on where. I think we are also learning that there's a lot of asymptomatic spread that may have been happening before we even recognized that the virus was present. And so if there's places that the virus is more of a stronghold than we realized before, those cases are going to be, even in a less populous area, could be higher than, like you said, in Jefferson County.
This is more of a, it's a long-winded question, but how has the pandemic disproportionately affected certain groups of people? And how have you seen that in your work?
So I'm guessing you're thinking about people of color and disadvantaged populations have been disproportionately affected by COVID-19. And I think that, some of this there's going to be a lot to say about, there's a lot of very important lessons to learn about how this exposes some of the inequities within our healthcare system. And I think if you look at how poverty, how you look at how healthcare access, how chronic disease affect different populations is really what we need to think about. So when you talk about who gets the sickest from COVID-19, it's people with chronic diseases. And so if you have diabetes, high blood pressure, heart disease, if you live in certain areas, your risk of getting some of these diseases are going to be higher if you're in certain populations. And that's not just because of genetics, it's also because of some of the socioeconomic and healthcare disparities that exist already. And so the social determinants of health that are really a big part of what determine whether where you're going to land on the healthcare spectrum and whether you're going to have access are part of that. So if you are a person of color, we know that your ability to access healthcare is going to be less, and so maybe these chronic diseases are more prevalent, and therefore you're going to be at higher risk for some of these complications. So not only that, the ability to stay home in lower income populations is harder because a lot of our essential workers right now are lower income individuals, and therefore they have to go to work and they're more exposed at this time. They don't have the ability to socially isolate. And so I think there's a lot of social and economic factors that play into this, and they're exposing a lot of the inequalities within our healthcare system and within our society in general.
So lastly, what are some ways we as teens and younger people can help out our communities or help spread awareness?
I mean, I think you are doing a lot of really good things, like this podcast that you're talking about, talking to other teens and talking to talking to people that you love. And they think that you guys have a lot of power to really bring out some of these issues. And I think living and starting to fight for some of the things that you're talking, like some of the inequalities that exist within our healthcare system are ones that have been here for generations. And so continuing to push for that change is going to be important. I think educating your family members, educating your peers about about staying healthy during this time period, but also how do we take this moment in our society and say, how do we build a better society out of this so that we don't leave people behind, that we don't have these gaps in healthcare. I think your generation is going to be the next one that's going to be really asked to start looking for solutions for this they're not new problems, but we do need to start thinking about new solutions, especially in a time when we're seeing so much disruption and how many different factors are really contributing to where we are right now. So I think advocating for the vulnerable people, advocating for for science and things like that are really important. So I think you're already on a really good track. So I think you just continue the hard work that you're doing now.
Thank you so very much, Dr. Shah, for meeting with us and helping us spread awareness about COVID-19.
Absolutely. It was my pleasure. Thank you guys so much.
And a special thanks to all medical staff who are fighting this disease and sacrificing so much. Thank you to Springboarders Iona and Suniti for being here as well. Check out the Pack Health website for more information and videos that can help you stay informed during this pandemic. Also, please check out the GirlSpring website for tips on staying healthy and positive during this time. Thanks, everyone. Bye.